It's all yours.
Okay. Dr. Dayton, Dr. Farshian, thank you, so much for having me speak today because this is a subject that's very passionate to me. And we're gonna get started. And I've given these lectures before, and that's because it's just so important, and it really enhances the treatment of regenerative medicine. So I'm going to be talking about the diagnosis and treatment of extra-articular pain in regenerative medicine. Okay. Today I will discuss how you can increase your success rate when performing the regenerative medicine procedures. The key is to know how to treat these stubborn, extra-articular tender points and trigger points. And I'm going to share with you pearls that were never taught to you during your training program. So it's very important, and it's really going to help your patients. Now, I was very fortunate when I did my rehabilitation medicine residency. We didn't have much physical medicine, but we had rehabilitation medicine. So I had to spend extra time learning physical medicine. And on our staff was this Dr. Hans Kraus, who was President Kennedy's back doctor, and he was all trigger point injections. He invented trigger point injections and invented all kinds of exercise programs related to trigger point injections. So I learned a lot with him. And then subsequently I spent time with the gentleman in the middle, and his name is Dr. Andrew Fisher. I met him at Mount Sinai in Manhattan. I was a voluntary attending at that time, and he was chairman of the Veterans Hospital in the Bronx and had a private practice in Great Neck. And he kind of made it more popular, the clinical entity of spinal segmental sensitization. And he also invented these different types of injection techniques, to combat musculoskeletal pain, which I use all the time. And it's been fantastic in my practice. So now I want you to hear about advanced techniques for pain management. And you'll listen, and then I'll start talking again. Oh, let me just get back again. We just skipped one here, but let me get back 1 second. All right.
I would like to discuss with you a highly successful new approach to treat many painful conditions such as neck and low back pain, arthritis of the hip and knee, tendinitis, sports injuries, headaches, fibromyalgia, and many other conditions. The goal of this treatment is for the patient to leave the examination room pain-free or with significantly reduced pain. It is based on the diagnosis of the affected segment of the spinal cord and treatment focused on its components. Once the level of spinal segmental sensitization is diagnosed, 3 injections are employed to eradicate the pain. The paraspinous block desensitizes the affected spinal segment. The pre-injection block anesthetizes the area to be infiltrated, and the trigger point injection mechanically breaks up the abnormal, fibrotic tissue, which is the source of the pain. Precipitating factors must be identified so there is no recurrence of pain. These precipitating factors may be